Hey, good morning. Yes, it is. It is Saturday, December 7th. A little chilly out there this morning and snowing in our area. So, what am I going to do with the video about today? So, I've been being asked a lot of questions about the warning signs that, I should have, recognized, and how far back can I trace it to where I started noticing something going wrong? And maybe this will help you not get to the point of where I was. So stay tuned. Alrighty, welcome back to the channel. My name is Eric, if you didn't already know it. And today we're going to talk about what led up to my quadruple bypass and wearing a life vest and a whole assortment of heart meds. So how far back can I trace it? I can trace it back to probably, I would say, February of last year. I noticed at that point it was taking more energy to accomplish not that hard a task, but I was kind of tired out after doing so. And then as time progressed, it started with, if I go lift the girls some grain in a 5-gallon pail, I would start getting chest pains in the front and then in between my shoulder blades. And I thought, well, it's got to be a pulled muscle or something, because it doesn't seem to bother unless I'm lifting to give the girls their grain. And it wasn't so much the lifting, it was the exertion of energy of trying to carry the 5-gallon pail, wrestle it between the girls that, they wouldn't do anything to me, harmful at all, but they just sometimes don't realize how big they are, right? So you're hustling around, moving quick, trying to stay ahead of them. And I think that was what was triggering my heart and my chest with the pain, and not so much the pails. So we started getting a little farther ahead, and now I'm finding no matter what I do, if it requires exertion, I start having chest pains, and I have to stop and just try to keep my breathing at a certain, until it finally lets up. And it does let up, but sometimes it'll go 15 minutes of just solid pain. So again, I wasn't looking at cardiac. I had thought about cardiac in the beginning, but it wasn't adding up, carrying pails. I chucked a little more energy for things that didn't take that much energy last year. I just chalked it up to getting older, And that when I started overexerting myself, the chest pains would show up. And so fast forward a little bit later, a couple weeks after that started up, I started getting pain right underneath my left breast. And I got a hold of my primary, Nicole, and said, can you get me in? There's something going on with pain. So she thought I was coming to get more pain meds. And I wasn't. I said, no, I'm trying to figure out what's going on here. I think I've ruled cardiac out. I'm not sure if it's a pulled muscle. It happens, quite a bit. I'll start getting the sharp pains underneath my breast. So she diagnosed it as a tear or a rip in the lining of the muscle in the rib cage, and prescribed prednisone for, I think it was 8 or 10 days. Now something else was going wrong. Not only was I having the chest pains radiating between my two breasts and my back, I was having the issues of the sharp pains underneath my left breast. And then now the body is starting to feel all achy. So I went to my massage therapist, and she kind of keeps me up and going since I had spinal fusion. But I was explaining to her where the issue was, and could she concentrate on that? Maybe it's a pulled muscle, and it just needs to be put all back in place. Well, after her session, it was almost a week and a half of pain-free. I wasn't having those chest pains. I wasn't having underneath the breast, the achiness, nothing. I felt really good. But if I grabbed a pail of grain and lifted it, I would get those pains back quickly. So, a little fast forward a little further ahead, and I'm feeling like crap. So I go down to the after hours clinic in Canton, and the nurse practitioner there said, Eric, I think you have something cardiac going on. I said, no. I said, my primary and we've already ruled that out. And she said, well, how'd you rule it out? I said, well, it comes at a certain time. It depends on what activities I'm doing. And she said, well, I'll take a shot of your lungs because you got a wheeze, and we'll go from there. Well, she found that I had pneumonia in my left lobe. So she put me on antibiotics to cure that up. And it was about day 4 or 5 of the antibiotic treatment that I got a hold of my primary, and they said, all these things that we've been trying are not working. We need to go back to step 1, and that is cardiac. So I used to be an EMT for years. And your worst patient ever, I'm telling you right now, and you can ask any nurse, is someone in the medical field. Whether it be an EMT or up to a doctor, they are the worst of the worst for nurses to have to take care of. And why is that? Because they're too busy diagnosing what's going on with them and what they need, instead of just sitting back and relaxing and putting faith in the people around you. So she's like, all right, I've got an appointment for you in Governor. I want you to go down. I want you to get an EKG, and then I'll give you a shout or a message, within the next hour and a half to see what's going on and see if it's anything to do with cardiac. Well, an hour hadn't passed, and she's on the phone, and she's like, do you have a ride to Governor Hospital? Can someone drive you there? And I said, yeah. I said, Claude's right here. She said, well, I want you to get your ass to Governor Hospital right now. She goes, no ifs, ands, or buts. Get your ass to Governor. And I'm thinking, what the hell did she see on that EKG? But while I was here getting the EKG, they took some blood. See, and they can look back and look at the blood. And there's something in the blood that will kind of give them a positive that you've had a heart attack in the recent past that is picking something up. So I thought, well, maybe it is cardiac. Maybe they caught, where I had a light heart attack maybe, and that's what's been causing all this. And so I'm walking into the ER, and you have to go over to where it's information, but they basically do an intake on you and get you a wristband and tell you to go over and sit, But as I was trying to walk there, a nurse come right out. And she said, are you Eric? And I said, yes, I am. Come with me now. I had 3 nurses stripping me down to my underwear and telling me to get on the bed. And then they started doing IVs. They had me hooked up to the monitors. And the doctor comes in and says, do you know what's going on? And I said, I haven't got a clue. And he said, well, your EKG is really bad. And so wasn't the blood that we got from you. right now, Upstate Medical has got a bed for you, and they're waiting to do surgery on you tonight. That's how bad they think the EKGs and everything are. So, 2.5 hours in the back of an ambulance with a young nurse. She was great. And a young nurse as well up front that was driving. And normally when you get to Upstate, they've got a large ER, right? And when you come in by ambulance, the normal thing is you get put into a room, and then a doctor comes in, talks to you, whatever else, and decides what to do with you, right? But as they're pulling me off the ambulance, the young lad there asked her, the nurse, do we have to check in here at the ER? And she said, no. They've already opened the doors all the way up to the surgery. They're waiting on him, so we need to take him right up to the OR. I'm thinking, this is serious, right? So they get me into a room, and Dr. Pawlowski comes out and says, it'll be just a few minutes. We're finishing up on an older gentleman that had an issue with the first surgery. But it shouldn't take that long. So my son Robert was with me. And there was a male nurse in there. And I'll tell you, I had to pee terrible. But I had this problem about peeing in public. If somebody's watching me, I can't pee. So I asked him, I said, is there another way? And he said, look, you're going to need to be catheterized anyways. I can do that right now and get you set up on that. That'd be one less thing they have to do in there. And I said, that sounds like a plan. He and my son were commenting back and forth that they'd never seen someone that had that much urine in them and that much pressure, on the kidneys. But I remember being taken into the OR and being talked to, kind of a blur, and getting things hooked up, and everybody trying to introduce themselves. So that was the last thing I remember. And filling in the blanks, Dr. Pawlowski and my daughter were telling me that they had lost me on the table for a short period, that my blood pressure had just tanked. And with the drug warfarin, that's what they use to thin your blood so that they can work on you. But there's also a downfall of it, is you can get a bleed. And that's what happened to me, was something had started bleeding, and 8.5 pints later, they had me back in a decent blood pressure. So, as far as I know, other than just that, there were no other incidents with the surgery. It went well. It went according to these guys that work and do this every day. And I can remember coming to in recovery and not being able to move. And if I did move, my chest hurt terrible. And they would ask me, do you know where you are? Do you know what today's date is? Do you know what? And at the time, I just thought they were checking my cognitive skills to see, how far gone I was. But I think what they were doing was that when they lost me on the table, I also would have had less oxygen going to the brain. So there is a chance you can be a vegetable on the other side if you're without oxygen to your brain for a long period of time. But I can remember early on, I couldn't answer the questions correctly. I didn't know the answers. And the only reason I knew I was in upstate medical was there was a plaque on the other side of the wall where I could see it. And it said upstate medical, but I kept calling it University Hospital, and they would tell me I was wrong, even though I could see where it said upstate medical. So in the beginning, yeah, I was having major problems just trying to talk and say anything that made sense, per se. And you could blame a little bit of that on the anesthesiology, the drugs that put you under, and all the drugs that they have on board, could have also been. But by week 2, I knew exactly where I was, what the date was, when my birthday was, who I was, and who the people around me were. And I think it's just getting away from the drugs that were given to me in the ER, as time progressed, it worked out of my system. But for the first week, I laid on a hard table, it felt like. And I want to say I was strapped down, so I couldn't move and tear stitches and everything else. But all I could have was sips of cold water. And I would try to drink that because my mouth was so cotton mouth, drier than dry. And the first nurse, he was great. He's like, Eric, you can't drink that fast. Just take sips. And that was kind of like Hell Week. I lay there with a gown, and that's all I've got. And they've got a blanket over me. But this is where I started getting, the not able to pee in public and all the other stuff, the shyness was no longer there, because every shift I would be bathed. And when I say bathed, it's head to toe. And you get a new gown, and then you have another day, you wait all day long for it to. But they still had drugs on board that I was falling asleep a lot, so it wasn't as bad as it could have been, I guess. Week 2, I was able to sit up, and they wanted to start like some Jello, pudding, that kind of stuff, just something light. So for the second week, it was kind of light on the food. And going into the third week, I could order whatever I wanted, but there was a sodium limitation on it and a calorie limitation. So I had 2 different ones that worked for the cafeteria. One young fella, great, and the other one was a younger gal, and she was good as well. But they would ask you what you want. And all I can tell you is by week 3, everything I ordered tasted the same, like crap. And I started just ordering peanut butter and jelly sandwiches, chicken noodle soup. And that was it, and some Jello. But one of the things that they want you to be able to do is crap when you're there, right? So going into week 3, I was able to do that, so I thought I should be able to get out quick, And you don't just do that, right? I still had the chest tubes. There were 4 of them I had coming out, and they were still draining a lot, so the doctors wanted to keep me longer. And actually, the day he thought I'd be released, it was a week and 4 days from that day that he thought I should be able to go, but because of the drainage. And Nicole with PT, she continued to get me up and walking on a daily basis and showing me how to bathe myself over, Like I say, I am, at this point, there is no shyness. I could walk up and down the halls buck-ass naked. It wouldn't bother me a bit, right? I mean, everybody's seen everything, so Because I can even remember, because I started off in the cardiac ICU, which is 8F is what they call it. And everybody on that staff was superior. The biggest thing I can remember is that they were all under 25. Most of the nurses that were working on me were 21 to 25. And I'm thinking, wow. And these guys, Emily, I think, was probably the best because she thrived on chaos. And if it was just mundane, she'd be making faces through the glass at me, everything else, just to get me to laugh. Super, super nurse. But I ended up losing her because they had a couple come in that were worse off, needed more care than what I needed at that point. So they stuck me with this one nurse. It was a guy. And he was in his mid-30s and complaining that he probably should have started earlier and back when he was 19 or 20. But he kept taking off and spending all the time down there with this other gentleman that, was still hooked up to everything. See, by then, I had what they call a PICC line right here in my neck. And I had ports all around my head and down my back. And what they were doing is they were tapping in all these different ones. Magnesium, you get your regular IVs, and anything else the doctor wanted to add. They would just plug it into one of the lines and let it go. But I was up and walking towards the end of week 2. I had to use a cart to be stable with it. And I started off with doing one lap, which they figure is around 300 to 400 yards. And by the time I was into week 3, they had me doing that 4 times in a row. And towards the end of week 3, I was walking without holding on to anything. And Nicole was on one side of me. She was carrying the containers where the stuff coming out of my drain tubes were going, so I wouldn't have to hold on to that because of the weight. But yeah, I did it, I think 3 times without the cart and sat down. But what I can tell you is the only one that was kind of iffy out of the whole bunch was the older nurse, the guy, complaining about where he was in life, basically, and how the younger nurses were getting all the more important jobs, I guess it was, people that needed more care at the time. But by the end of week 3, a bed had opened up on 8G, which is still the ICU, but it's not the cardiac ICU. And see, when I went into the cardiac ICU, I stayed in the same room the whole time. And then when they transferred me over to 8G, I would remain there until discharge. And the one thing is, I'm trying to think of her name. Erin. She said, "Do you remember me?" And I said, "No." And she said, "Well, I was here when they took the tubes out of you, the intubator, and started bringing you around." She said, "Do you remember any of that?" And I said, "No, I don't remember nothing of that." So I get transferred back to that same room as the one that had opened up, was the one I was at before, just after surgery. So we'll keep going on. It's a little bit later in the day. I had to get a shower this morning and get my new girdle on. We have a lot of problems with it this morning because it keeps constantly going off saying the probes aren't correct. And I had to wash the other one, so right now it's drying laying over the back of a chair because you can't throw it in the dryer because it's got electrical parts to it. So back to being on the ICU cardiac. about three times a day and into the night. One was 2 o'clock in the morning. X-ray is coming in and wanting to do a shot of my chest. And I'm not sure if they're looking at my heart or if they're concentrating on my lung with the pneumonia, because usually just following it, the person would come in and give me an albuterol treatment. So I thought, well, maybe they're seeing stuff still in the lung, that they're trying to clear up. But I take 5-6 a day of the albuterol treatments. And then they would wake you up at 3 o'clock every morning, I think 9 o'clock in the morning, and then I think 6 o'clock at night to draw blood. I mean, guaranteed, someone was drawing blood off my arm, at 3 o'clock in the morning to see what my levels were. So when the doctor got in, he could look at the levels and decide what he wanted to do with the medications. And so by week 3, I was up and going and moving around, but I still had too much drainage coming out of my chest through the chest tubes to be able to get released. And I was also retaining still too much fluid. My legs were swelled right up. My feet were swelled right up. So even now I'm on Lasix, and it's basically dewaterer to try to take the water off. And it's getting a lot better the more I move it around and do stuff with it. I still can't feel my right leg, or down from the stitch line up. It's all still numb, so maybe that's a good thing, right? So we get into week 4, and the only thing pretty much holding me back is the chest tubes, the chest drainage. But Dr. Pawlowski is still playing with medications too. So he tends to be on the conservative side, which isn't a bad thing. And he came right out and told me, he said, look, Eric, you got 2 options. I can send you home to it early, and then in a day or 2, you're going to be right back here. And it could be back over on the ICU unit cardiac because something has gone haywire. Whereas just be patient with me and let me decide when it's the right time to release you. He said, I'm still playing with your medications. We're still got too much fluid coming out of your drain tubes. And you still pretty much have too much swelling in your legs to feel comfortable with sending you home. And looking back, he was 100% correct. But at that point, I wanted to come home. And the day had passed that he said that good chances are I could go home. And it's not because he wanted to keep me there. It's because chest tubes were still in, swelling in the legs. And he was still tweaking the magnesium, I think, because she had to keep adding magnesium through an IV. Week 4, we started off with, I was hoping to, because during that week, it looked like it was going to be some pretty good snowstorms coming in, right? So Monday and Tuesday, it looked like it was clear sailing. Might get a little bit of rain, but it was pretty much, it wasn't below 0 or below freezing. So I hoped that Monday or Tuesday, Dr. Pawlowski would release me. So finally, Monday morning, I can remember Greg come in, and he said, we're going to take that drain tube out, and we want to see how much you drain between now and tomorrow morning to see if you're losing a lot of fluid out of those holes. And they explained to me, said this could drain for weeks. Just simply put a cloth bandage with one piece of tape so that it's basically to keep it from soaking through your t-shirts, right? But there wasn't a lot of drainage, and they were prodding and poking, and a few of them wanted to hear my lungs because they were wondering if the fluid was building up inside my lung and that's not draining where it should be draining. And my lungs were pretty well clear by that. So Dr. Pawlowski, that morning when he came in, he said, I think, well, he wasn't on. It was Dr. the other Dr. Shaver, but said we run out of things to hold you. Said that the chest tubes were fine, all the levels were fine, the medications were fine, and did I have any questions for him? And I said no. So I texted Aaron, head this way, and that was around 8:30 in the morning. Well, once that doctor sends that order over, they do a quick paperwork stuff, and they got to get you out of that room so that they can get somebody new into that room to charge the insurance. I assume they try to keep every bed full. But it was like 10 in the morning, and she said, we're going to take you down to the lounge, and when your daughter gets here, you can just go out and get in the vehicle from the lounge, or they'll take you down to your daughter's car. And I'm thinking, they're going to set me out in the front lounge where people are coming in and going, and it wasn't. It was a patient lounge, kind of like a private oasis. You had tons of food and drink and everything else in there, fruit that was there for the taking. And I sat there until I think it was 1:30 when Erin finally got there, and they said to have her call, and the gal in there would run me right down, and she did. And we got about 3/4 of the way down, and we see Erin waving her arms, so we knew she was down there. So got in the vehicle, and we stopped on the way back here at the house for a stretch, and then from here I went up to her place for 4 days, and then back here where I've been by myself now for a while. This whole week I survived it. And I'm getting out of the house. I mean, Claude picks me up at a little after 7 in the morning, so I go down to the shop. I answer the phone. I do billing, and people that call that want to use their credit card to pay for their bill, Claude doesn't know how to do that. So with me being there, I'm able to get some of that money coming back into the accounts where it needs to be, because it pretty much got shut down the whole time I was in the hospital. Claude was doing just enough to get him by, and it's hard to have one individual down there, and it's hard for me being down there this week of not being able to do anything to help him, and he gets snappy at me as far as if I wasn't just staying over there sitting in my chair or just some light walking around the front of the shop. But he didn't want to see me picking up anything. He didn't want to see me touching anything other than the keyboard and the phone. But that's where we're at today. Today is Saturday. I'm doing pretty good. Since I've gotten back from my daughters, I've lost 4 pounds. That's how much she was feeding into me. She's coming tomorrow, because some of the things that I need for the house that I don't have here, and one of them is a salad bowl so I can make salads. But I think I had the first call, like on my life vest, when it goes off, if my heart is a little bit out of rhythm, it vibrates all the probes on me. So if I'm sleeping, it'll wake me up. That's the first one. You squeeze it together, right? And you wait. This is the good one. You wait, because if it comes back on within a minute and a half, you need to lay down on the floor. And when you squeeze those two together, you are giving yourself the shock to bring it back where it needs to be. And if it doesn't do it, then it'll ask again, and you hold it again. And I said, what happens if I've passed out? And they said the first time they'll let you squeeze it, nothing happens. Second time, if you don't squeeze it, and that's where it would be shocking you, it goes into a third phase of where it doesn't need your permission. It's going to shock you. And I've had to explain to the people around me, if I go down and that red button is flashing. Do not touch me. Do not touch me, because you will get one hell of a shock that could actually stop your heart. So I know it's going to take me a while, and crawl, walk, and run. And I know that I get winded easy, but that's from just last week. I got myself twofold better. And not only am I going down to the shop with Claude during the forenoon, because we only work till noon, I also, I got out yesterday and went to Price Chopper and picked up a few groceries there. The only problem I had was the monitor went off once. And I'm like, because Jeff, the sales guy, is like, if it goes off, stop what you're doing, concentrate on your breathing, and just try to bring because it also looks at how fast the heart is beating, right? So he said, you just got to stop what you're doing and let it slow down. And that's what I did, and then I continued on with my shopping, and it didn't go off again. So, but it's happened twice since I've been home. The first time, it hasn't gotten to the second. Because if it goes to the second and it nails you, guess where you're headed? Yep, back to the ER, and probably back to the ICU cardiac wing. Find out what's going on. Hopefully this video is kind of helped you. And you only get one body, right? And one of the hardest things that I had wanted to do in the past and never could was quit smoking. And the whole time I was in that hospital, they asked me a couple different times, because they knew I had smoked 3.5 packs a day. Do you want a nicotine patch to I said, no, I don't have any craving for it or nothing. And since I went 3 to 4 weeks without a cigarette, I'm thinking, if I can go that long, why do I need them? It's going to save me money if I quit smoking, right? And I haven't smoked a cigarette since coming home. I like my Labatt's Blue, and usually after work, 3 o'clock, I'd come home and I'd have 4 or 5, before dinner, and possibly one during dinner. I've been home a week, and 3, I think I've had. But that's this unit going off, telling me that the probes aren't right. So on that note, you guys have a great day, and we'll see you here probably bright and early tomorrow morning. I gotta fix this.